Hey everyone! Today we're diving into something that's a huge source of hand pain and, honestly, just frustration for so many people: trigger finger. We're going to break it all down: what it is, why it's happening, and most importantly, how you can get relief. And we're basing all of this on the latest clinical research.
So let's start with a feeling that, might be a little too familiar for some of you. It's that weird, sometimes really painful, catching or locking feeling you get when you try to straighten your finger. It's like it just gets stuck, right? And sometimes you even have to use your other hand to physically pop it back into place. So annoying.
All right, here's what we're going to cover. We'll look at that annoying click, how it's diagnosed, non-surgical options, the surgical fix, a really cool modern approach, and finally, your path to relief. Let's get into it.
Okay, so what is actually going on inside your hand to cause that click? It's not just some random thing your body's doing. The fancy medical term is stenosing flexor tenosynovitis. Yeah, it's a mouthful. But don't worry, what's actually happening is pretty simple to understand.
Think about it like this. Your tendons are like ropes, and they slide through these little tunnels in your palm called pulleys. It's a system designed to keep everything moving smoothly. But with trigger finger, the very first tunnel, the A1 pulley, gets inflamed and swollen. It thickens up, which makes the tunnel way too narrow, so that tendon rope can't glide through anymore. It gets caught, it gets stuck, and that is the triggering. That's the click you feel.
So, who's most likely to deal with this? Well, what's fascinating is the pattern here. Overall, about 2 to 3% of adults will experience it at some point, but it's actually more common in women, and it usually pops up in the ring or middle finger of your dominant hand. And here's a really key point. For people with diabetes, it's not only more common, but it can also be a lot more severe.
All right, let's talk about getting a diagnosis. And the good news? It's actually really straightforward. A doctor can usually figure it out just by talking with you about what you're feeling and doing a simple physical exam of your hand. No fancy, expensive imaging needed in most cases.
So to get more specific, doctors use what's called the Green Classification System. It's basically a way to grade how severe the trigger finger is. It goes from grade I, which might just be some pain and tenderness, all the way up to grade 4, where the finger is literally stuck in a bent position. And this isn't just about putting a label on it. This grade is absolutely crucial because it helps your doctor figure out the best way to treat it.
Okay, so you've got a diagnosis. What's next? Well, the great news is that the first step is almost never surgery. We almost always start with more conservative, non-surgical treatments that honestly work really well for a lot of people.
And get this. This is pretty amazing. One study found that for 52% of people, so more than half, the symptoms just went away on their own within 8 months, with no medical treatment at all. Sometimes the body just figures it out and heals itself. Kind of wild, right?
But, if waiting around isn't really an option because it's just too painful or annoying, there are two main things we do first. One is splinting, or orthotics. Basically, you immobilize the joint for about 6 weeks, which just gives that inflammation a chance to calm down. The other big one is a corticosteroid injection. A doctor injects it right into the tendon sheath, and it's super effective at knocking out that inflammation. We're talking relief for up to 80% of people.
Now, those injections sound great, and they often are. But there's a really important thing you have to know about them, especially if you think surgery might be in your future. It's all about the timing.
And here's the bottom line. You absolutely should not have surgery within 3 months of getting a steroid injection. Why? Well, studies have shown a higher risk of infection after the surgery if it's done too soon. So the rule is you gotta wait at least 3 months. That gives the steroid time to clear out and keeps that infection risk way, way down.
So what happens if you've tried the other stuff and it's just not working? For people with those stubborn, persistent symptoms, surgery is an incredibly reliable option. It's the one that goes in and fixes the actual mechanical problem for good.
And I mean, just look at these numbers. They really tell the story. One big study looked at patients 1 year later. For the steroid injections, the success rate had dropped to 49%. But for surgery, a whopping 99% success rate. It's pretty clear which one is the definitive long-term fix. That's why it's considered the gold standard.
So what does the surgery actually involve? It's really direct and to the point. The surgeon makes a tiny incision in your palm, and they just release that thickened A1 pulley. They open up that tight eyelet we talked about earlier, and once that's done, the tendon has all the space it needs to glide freely again. The catching and locking? Gone. Instantly.
And even for a procedure that's already pretty straightforward, things are always getting better. Surgeons are constantly finding new ways to improve the experience for the patient, cut down on risks, and even lower the cost.
Which brings us to a really cool innovation called the Walland technique. Walland. It stands for Wide Awake Local Anesthesia No Tourniquet. And it's exactly what it sounds like. They use a special mix of local anesthetics, so the whole thing can be done while you're wide awake. No general anesthesia, and, this is a big one, no painfully tight tourniquet on your arm.
So what does this mean for you? Well, the benefits are huge. First off, you skip the pain from that tourniquet. You also avoid all the risks and grogginess that come with sedation. And here's the really neat part. Since you're awake, you can actually move your finger during the surgery. This lets the surgeon see, in real time, that the tendon is gliding perfectly. Plus, you're out of the recovery room way faster. We're talking like 30 minutes instead of over an hour. And yeah, it's also cheaper for the healthcare system. It's a win-win-win.
All right, we have covered a ton of ground, haven't we? From what's actually happening inside your hand all the way to some really modern surgical techniques. So let's bring it all home and lay out the clear path to getting rid of that trigger finger for good.
The best way to think about your journey is like climbing a ladder. You always start on the bottom rung with the simplest, least invasive stuff. Rung number 1, just observation. Because remember, a lot of cases just get better on their own. If that's not cutting it, you climb up to the next rung, splinting. Still no luck? The next step up is a steroid injection. And only if all that fails to give you lasting relief do you climb to the very top of the ladder, surgical release, the definitive final solution.
Look, the whole point of this is to give you the knowledge you need. When you understand what's causing this, how it's diagnosed, and all the different ways to treat it, you can have a much better conversation with your doctor about what's right for you. The most important thing to remember is that you have options. You don't just have to live with it. So the real question is, what's the first step you're going to take on your path to a pain-free, click-free hand?